This is our project on pancreatic cancer and its background research by Yukti, Malik, Dhoon, Amin, Mandar, Padole, and Pranav, Naik. So what is pancreatic cancer to begin with? Pancreatic cancer is a type of cancer that starts in the tissues of the pancreas. Its most common form is pancreatic ductal adenocarcinoma. It impacts digestion and the blood sugar control, and is often diagnosed late due to the lack of early symptoms. So in figure 1, you can see pancreatic cancer shown in the human body, which is the highlighted orange part. So there are normal cells and there's cancer cell division. So what's the difference? So normal cells often follow checkpoints in G1, S, and G2, which is the phases in interphase. It also follows in mitosis and cytokinesis, which altogether is the whole cell cycle. It produces 2 identical daughter cells, and it's essential for growth and development in the body. Cancer cells ignore checkpoints, and they divide uncontrollably. Mutations in driver genes, which lead to uncontrolled growth. Pancreatic cancer affects G1, S, and G2 checkpoints, which is again interphase. So in figure 2, visual differences between normal cells and cancer cells. The top row is normal cells, where you can see a controlled amount of growth of cells, whereas cancer cells, you can see an uncontrolled amount of growth of cells and how disorganized it is. So key mutated genes in pancreatic cancer. So in this chart, you can see that there's KRS, TP53, CDKN2A, and SMAD4. So in KRAS plays a vital role in cell signaling and growth. When disrupted, it becomes constantly activated, leading to continuous cell division. So this mutation significantly impacts apoptosis by promoting survival signals, preventing damaged cells from undergoing programmed cell death. For TP53 is crucial for tumor suppression and DNA repair. A disruption in this gene results in a non-functional protein that fails to regulate cell cycle checkpoints. This failure has a dire impact on apoptosis, as the damaged cells are not directed to die, allowing cancer cells to proliferate uncontrollably. CDKN2A. The CDKN2A gene controls the transition from the G1 to S phase, again found in interphase, of the cell cycle. When inactivated, it prevents the normal regulation of this crucial checkpoint, and as a result, cells can bypass these controls, leading to uncontrolled growth without the normal apoptosis that should occur in these damaged cells. SMAD4. SMAD4 regulates the TGF-beta pathway, which is vital for controlling cell proliferation. Disruption of SMAD4 impairs this pathway, affecting the regulation of the cell growth. Moreover, it diminishes signals that promote apoptosis, allowing cells to survive longer than they normally would. So all in all, these mutations highlight the intricate ways cancer can manipulate cellular processes to promote growth and evade normal apoptosis. Understanding these mechanisms is crucial for developing targeted therapies and advancing cancer treatment.
Here we have some screenshots from the Cancer Atlas assignment that are presented throughout the slideshow. Now we have the real patient data from the same assignment using the CBio portal website. We looked at 3 patient samples that all had mutations in CRAS gene, which is the most frequently mutated gene in pancreatic cancer. As you can see in the chart, all 3 patients had the exact same mutation, G12C. That's a missense mutation, which means one amino acid in the protein was changed. In this case, it affects how the CRAS protein functions and causes it to stay permanently on, telling the cell to keep dividing, even when it shouldn't. We also noticed the gender of each patient. 2 are female, 1 is male. These samples came from different cases but show a consistent trend. The same CRAS mutation shows up often, especially the G12C change. This helps scientists figure out which mutations are most dangerous and how to target them with treatments. Next, we have the causes of pancreatic cancer. Pancreatic cancer is caused by the mutations in specific genes that disrupt the normal cell cycle, leading to the uncontrolled cell growth. It can also arise from both genetic inheritance and family and environmental factors. The genetic components are the mutations in genes like CRAS, TP53, CDKN2A, SMAD4. The environmental component is smoking, obesity, and chronic pancreatitis increase the risk of developing pancreatic cancer. Smoking is also responsible for 20 to 30% of the pancreatic cancer cases. Now we have the risk factors. Pancreatic cancer is influenced by many risk factors, including smoking, alcohol use, obesity, having the age over 60 years old, type 2 diabetes, inherited mutations / family history, chronic inflammation of pancreas, and even more.
On this slide, we can see the global distribution of pancreatic cancer across the world in different countries. Here we have figure 10, which is a world map given by the World Health Organization 2018, which shows a rough estimate of how many cases of pancreatic cancer are found in individuals per 100,000 in different countries. And we can see that there are higher rates, greater than 7.2 in a lot of European and in Eurasia as well. And there's also like high cases in North America and some parts of Asia and Australia as well. And the causation for these high rates or just differing rates across the globe could be linked towards just lifestyle choices of the individuals themselves. For example, smoking and notoriously unhealthy diets that include like processed foods can contribute to just higher instances and risks of having pancreatic cancer. Some symptoms that are linked with pancreatic cancer also include the yellowing of skin or eyes, also known as jaundice, uh, and it's caused due to liver issues, as like the liver is crucial for blood purification. And if there's problems in in the pancreas, there's most likely going to be problems in surrounding organs, which includes the liver. Next, there's also sudden weight loss with individuals not trying for it, and that could just be signal health issues such as poor nutrition or illness, which is related to pancreatic cancer as well, because if the pancreas assists with the digestion of foods by producing enzymes, and so if there's something wrong with the actual nutrition you're that's being broken down or digested, there probably is a problem in the pancreas. And just pain in the upper abdomen and your back could indicate issues in just that area, uh, like for example in your stomach or organs like your liver or gallbladder. Just pain in those areas is not normal, so there obviously is issues there. There's also some other symptoms include like dark urine and light stools. They indicate issues with waste processing, and that's often related to liver problems. And again, if there are liver problems, there's most likely issues in the pancreas as well, and just digestive issues, which are also heavily related to the pancreas. And last but not least, we have the sudden diabetes being suddenly found in adults who didn't have previous risk factors, and this symptom could indicate underlying health issues in patients, but they also um, can show problems within the pancreas that also contributes to blood sugar regulation. And from all of this, the question could be asked is if pancreatic cancer can be fatal, and the answer is yes, it can be fatal, as it often goes undetected, and just the rapid development of just like cancer in that area is extremely harmful for your digestive functions. And yeah, it's pancreatic cancer can is like only detected until more advanced stages, which are like really harmful, and that alone has high mortality rates. So to avoid this, there are some screening methods for pancreatic cancer, so we can detect it as early as we can to for treatment. And some examples include imaging tests such as CT scans, MRIs, and ultrasounds. They're used to detect abnormalities in the pancreas that basically show if there's cancer or not. There's also endoscopic ultrasounds or EUSs, and they're basically a thin tube with an ultrasound that's inserted through the digestive tract to get detailed images of just the organs through the system. And here on the slide, you can see figure 11, which shows a simple demonstration of the process of a regular CT scan. And here it just has like an individual and just like some steps in what could be happening.
Okay, so now we are on clinical trials. Now, clinical trials are conducted to test new treatments or drugs. Participants may include individuals diagnosed with pancreatic cancer at various stages, and here are two ongoing trials. So, trial number 1 is combination therapy with chemotherapy and immunotherapy for pancreatic cancer. And the focus of this one is combining chemotherapy with the immune checkpoint inhibitors to improve treatment effectiveness. And trial number 2 is targeting the KRAS mutation in pancreatic cancer. So this is basically testing a drug that targets the mutations, and this mutations will prevent tumor growth. Now we have our treatment options. So our first option is surgery. This is known as a Whipple procedure. It's going to remove the head of the pancreas, part of the small intestine, gallbladder, and bile duct, and it's used when cancer is only in the head of the pancreas and has not spread. Our second option is chemotherapy, and this will attack fast-dividing cancer cells throughout the body, and when surgery is not possible or when cancer has spread, this will usually be in use. Next, we have radiation therapy, where you can get a beam, and this beam will target cancer cells to kill them or shrink the tumors, and this is before surgery. And this is also combined with chemotherapy. So if you're doing chemotherapy, you might do radiation therapy. You might have to go through that as well. And number 4 is targeted therapy. And this is for patients with BRCA gene mutations. And this blocks cancer cell repair pathways. And this causes the cancer cell to die. Now we're on fun facts. So pancreatic cancer rarity. So pancreatic cancer is 3% of all cancer cases in the U.S., but it is one of the deadliest. And the 5-year survival rate is around 10%. So that's why you have to detect this pancreatic cancer, and you have to detect it quick and early. The most common form of pancreatic cancer is pancreatic adenocarcinoma, which comes from exocrine cells. Ongoing studies aim to improve early detection and treatment options. A diet rich in fruits, vegetables, and regular exercise may help lower the risk of pancreatic cancer. And November is National Pancreatic Cancer Awareness Month, which promotes awareness and funding for research. And some people live many years after a diagnosis, especially with an early detection and new treatments. And here are our references. Thank you for listening.